Bronchoscopy Setup and Assist. The purpose of a bronchoscopy procedure is to visualize the upper and lower respiratory tract. This is used for diagnosing and managing airway and lung disease or for procedural or therapeutic interventions. This can include bronchoalveolar lavage, biopsy, or removal of tissue and foreign objects, or for the placement of tracheostomy. Indications for the procedure according to the American Association for Respiratory Care include the evaluation of hemoptysis, localized wheezing or stridor, a positive or suspicious sputum culture, to check airway patency or function, to assess any problems from tracheotomy or endotracheal tubes, including damage, obstruction, or placement, recurrent or persistent lung conditions such as unexplained cough, pneumonia, atelectasis, or infiltrates, any unexplained lesions on chest x-rays, or for the location and extent of toxic inhalation or aspiration. The procedure is also indicated for the retrieval of lower airway secretions or cell washings, abnormal tissue, foreign objects, and mucus plugs that could be causing lobular or segmental atelectasis. And lastly, it's indicated to aid in difficult intubations, percutaneous tracheostomies, airway stent placement and function assessment, as well as airway balloon dilation of tracheobronchial stenosis. This brings us to contraindications. Some absolute contraindications listed for the procedure include a lack of consent from the patient or their medical representative. And this holds true unless it is a medical emergency and the patient is not competent to give permission. If there is inadequate bronchoscopists present to perform or oversee the procedure, or a facility is unable to handle any major complications. And lastly, if there is an inability to adequately oxygenate the patient during the procedure. The AARC also considers these conditions to be an absolute contraindication unless the benefit outweighs the risk, because these patients have an extremely high risk for serious complications, and that is any patient with coagulopathy or bleeding disorders that cannot be corrected, severe refractory hypoxemia, or patients with an unstable hemodynamic state, including dysrhythmias. Relative contraindications for this procedure, according to the American Thoracic Society guidelines, are patients with partial tracheal or superior vena cava obstructions, moderate to severe hypoxemia, hypercarbia of any degree, patients with head injuries who are susceptible to increased intracranial pressure, and recent myocardial infarct or unstable angina within the last 6 weeks. This is just a few of the relative contraindications. A complete list can be found on the AARC website under the Expert Panel Reference-Based Guidelines for Bronchoscopy Assisting. Bronchoscopy hazards and complications include adverse effects from medications used before or during the procedure, hypoxemia or hypercarbia, broncho or laryngospasms, hypotension, bradycardia or cardiac dysrhythmias, epistaxis or hemoptysis, pneumothorax or increased airway resistance, as well as infection or possible death. Now we will go to Saranya to discuss the equipment you may gather prior to the bronchoscopy procedure.
So now we'll be discussing the equipment necessary for the bronchoscopy procedure. So we set the equipment on the side of the ventilator so that we can assist the physician and monitor the ventilator settings. So the necessary equipments are the pre-clean kit for the reusable bronchoscopy, lubricating gel or spray, sterile water, 4 specimen cups, 2 closed for the specimen collection and 2 half open for pre-filled sterile water, 320 cc syringe pre-filled with sterile water, and two 10 cc syringe, one for backup and one for the drug with a blunt needle, swivel adapter with a white cork. This helps in for procedural bronchoscopy, and there's a blue cork which helps in diagnostic bronchoscopy, and this goes here. And the bite block to protect the tube and the bronchoscopy from biting, the lidocaine drug, two Leucan strap if the physician needs any sample for lavage, and a pack of 4x4. Suction setup should be ready with a max pressure. There are two types of bronchoscopy. One is a reusable bronchoscopy and the other one is a disposable bronchoscopy. This is a disposable ambuloscope where one end is connected to the monitor and the other end is inserted into the ET tube. So this is the toggle where you can manipulate the bronchoscope, and this is the suction pressure where you can apply the suction pressure while suctioning, and this is the suction port, and this is the insertion port where you can install saline, drugs or any add-on tools. So the physician holds the scope on his non-dominant hand with the thumb on the toggle and the index finger on the suction pressure, and the suction tubing is connected this way.
So just to recap the necessary equipment you should gather, includes a reusable scope cleaner. This is only used if the scope is reusable. Lubricating spray or gel. A large bottle of sterile water. 4 specimen cups. 2 will be used for collection, and 2 you will use and fill with sterile water, and you will loosen the lid so it's easy accessible. 3 20cc syringes, which will all be pre-filled with the sterile water. 2 10cc syringes. 1 will be used as a backup, and 1 you will attach a blunt tip needle, and this is used for medication delivery. You'll need to get a swivel adapter and cap. The white or clear cap has a larger port and is used for procedures. The blue cap has a smaller port and is used for diagnostic procedures. A bite block, lidocaine, and then if you need any other medications such as epinephrine, you will have to ask for those. 2 Leucan traps, a package of 4x4 gauze, a suction setup. You want to make sure you turn that to max pressure, and you may also need to gather extension tubing. And lastly, your bronchoscope. In addition to the equipment you will gather, some physicians may request certain add-on tools and may require assistance inserting and manipulating them. These tools might consist of forceps, which can be used for tissue removal, or a needle aspirator, which is used in biopsies. So here are some setup tips that will help you in assisting with the bronchoscopy. First, you want to set up on the same side of the vent, so you want to make sure that you're able to reach your equipment and the ventilator if needed, all within an arm's reach. Next, you want to be able to get plenty of chucks and towels to keep the area clean, and this will keep your nurses happy. If you are using any syringes or preparing containers for mucus samples or cell washings, you want to make sure all of those are properly labeled so that you know which each one is. And then throughout the procedure, it is helpful to keep extra lube emptied out onto a 4x4 so that whoever's performing the bronchoscopy can easily apply this to the bronch if necessary. And now let's go back to Saranya to discuss the necessary steps to set up for a bronchoscopy procedure.
So remember, this is a sterile bronchoscopy is a sterile procedure. So everything, all the equipment setup, basically the bronchoscopic setup, should be maintained in a sterile field. So we have to lubricate halfway through the bronchoscope till the distal end and hang it so that we can wait for the physician for the procedure. So as I mentioned earlier, we have to insert the bite block to protect the scope and the tube, and we have to attach the swivel adapter between the tube and the ventilator, and this is the scopic bronchoscope insertion port. You have to make sure that the suction is set up and it's set at max pressure. And the ventilator, the patient should be hyperoxygenated with 100% oxygen during the procedure and 5 minutes after the procedure as well, and make sure that the FiO2 is back to the previous setup. And the monitor should be set up with all the patient details, and the white light source should be on, otherwise, so that we can visualize when we insert the scope.
So just to recap, setup requires us to prepare the bronchoscopy by removing it from the package, connecting the tubing, and lubricating halfway up the scope, inserting a bite block to protect the scope, attaching the swivel adapter in the proper cap, verifying the suctioning system is set up and working, make sure the patient is hyperoxygenated with 100% prior to the procedure. Then you're going to want to make sure the bronch cart has all the patient information entered and the equipment is set up. And lastly, you might be required to turn on the white light button, and because without this you won't actually be able to see anything from the bronchoscope. So now Saranya will take us through the holding technique and how to manipulate the bronch.
As I mentioned earlier, the physician will hold the scope on the non-dominant hand with the thumb on the toggle and the index finger on the suction pressure. The suction tubing is attached to this port, and this is the insertion port. So when the physician asks for any sterile water or drug, we insert the syringe and instill saline, and the physician stabilizes the ET tube on the dominant hand with the pinky below the tube, and the index finger and thumb are used in inserting the bronchoscope.
Here we can visualize a bronchoscopy view. So the bronch has entered the patient's oropharynx, and as you can see, the larynx is visible. As we go through the larynx and descend into the trachea, you can see the tracheal rings as we go down. Now we've reached the carina. This divides into the left mainstem and the right mainstem bronchus. And here we progress into the right mainstem, where we can see the right upper lobe visible in the top right corner of the video. And we can also see in the right lower bronchus and the right middle lobe bronchus. And so that was just a quick view to kind of see what you'll be seeing on the screen. So now that we've seen the respiratory tract, let's go to Saranya to talk about the respiratory therapist's responsibility during the procedure.
So during the procedure, make sure that the 20 cc syringe are always pre-filled with the saline, and the 10 cc syringe is pre-filled with the drug, and the 4x4 is lubricated with a lubricating gel, so that if in need we can use them on the scope.
So just to recap what Saranya said, we keep the 20 cc syringes filled with saline so that it is ready when needed. We have lidocaine prepped and ready if it is needed. We will keep a 4x4 gauze with the lubrication gel so that it can easily be applied to the end of the bronch. You are also responsible for monitoring the patient's vital signs and maintaining the airway during the procedure. You will continually mute the high pressure alarm on the ventilator and assist the physician in any way needed. After the procedure, you will continue to monitor the patient's vital signs and breath sounds and note any changes which might indicate complications such as pneumothorax. Going to clean the equipment if applicable and remove the swivel adapter. Most importantly, you must remember to wean the FiO2 back to the previous setting. You will need to process and label any specimens if they were collected during the procedure. You're going to want to chart the procedure. and then restock the equipment and apply any charges per hospital policy. Well, that concludes our video on bronchoscopy setup and assist. Thank you so much for listening, and at the end we have a reference slide.